I'm here to present on understanding and reducing heat-related illnesses in the farm workers. And as Dr. Martinez Bianchi mentioned, I'm a PhD candidate in population health sciences. I'm on my third year, and I've been working with the North Carolina farm worker community for the last 3 years or so. So to get started, and please don't feel shy if I need to slow down for the translations, please feel free to interrupt me. So the World Health Organization declared climate change as the greatest threat to global health in the 21st century. And this was declared over a decade ago. And so we've probably seen this, the changes in climate and how it's impacting our daily lives and our health, exacerbating in recent years. And so to show you a picture based on climate-related global disasters worldwide. So this is a UN report that started tracking disasters by event types and frequency of these events. And so you see the two portions of it. The top one is from the 1980s to 1999. So it's 20 years. And then the second one is 20 years. So it would be very interesting to see how it's changed for the next 20 years. However, in the past, since the new administration, the United States has stopped keeping track of these. So there's going to be a lot of missing data. But you can see here that two of the biggest disaster types are floods and storms. And this trend continues. However, in the bottom row, you'll see, and I did the math, you see that the one that has grown by over 200% has been extreme temperatures. So even though they are not the most frequent, they have exponentially grown. So the impact of climate change on health, we see it in direct effects and indirect effects. And some examples of direct effects are heat-related illnesses, respiratory diseases, heart disease, food, water, and vector-borne diseases, injury, premature death, mental health impacts, poor maternal birth outcomes. And in indirect effects, we see more chemical releases into the environment, changes in air, water, food quality and quantity, population displacement and forced migration, interruptions to healthcare, and infrastructure and supply chain disruption, which for many of us here in North Carolina, we saw this with Hurricane Helene recently. And we also see a lot of economic impacts, more people living in poverty due to climate change. And um, okay. And so just as many other things with health, climate change affects us unequally. And underserved populations with health disparities, exposed workers, which is a population that I'm going to focus on today, persons with disabilities, and there's also vulnerability by life stages. The younger and the older populations are more vulnerable. Vulnerability associated with chronic medical conditions and persons living in low middle income countries. And so then we go into climate justice and health. So what is climate justice and what does that mean when we talk about it? So climate justice acknowledges that marginalized groups are disproportionately affected by climate change. The risk associated with climate change can worsen health disparities by intersecting with pre-existing social injustices. It promotes fair access to resources necessary for adaptation, healthcare, clean environments, and participation in decision making. It prioritizes equity and climate policies, results in better and more inclusive health outcomes, and community knowledge and initiatives driven by local populations that are crucial for creating climate resilient strategies focused on health. And so we see a little bit of the how do we mitigate climate change, which is increasingly necessary, especially as we hear all the large data centers absorbing a lot of our energy and water, but it's also a lot about adaptation. You know, it's already getting warmer. How are we adapting to a much warmer climate? And to show you heat, since that's our topic today. So heat waves are unusually hot days, and heat wave events are a natural part of day-to-day variation in weather. But as the Earth climate warms, there are hotter than usual days and nights that are becoming more common. And so here we see over the overall trend of all these four different graphs is that it's going up. And so the average number of heat waves per year are increasing. We're seeing more heat waves. The average length by days, so our heat waves, instead of lasting 3 days, they're lasting 4 to 5 days. The average length of the annual heat wave season are getting longer. So our heat season, even in North Carolina, it's getting longer and longer. So, currently it's from May to September. Um, and then the heat wave intensity. So it's not just getting longer, it's getting hotter. So the degrees in heat is they're going up. And extreme heat is the invisible climate disaster. So compared to all of the other climate disasters, we see the aftermath of hurricanes, we see the aftermath of wildfires. Heat is invisible. We don't see it, yet we feel it and we're experiencing it. Our health is being impacted by it. And so extreme heat deaths in the United States from 1979 to 2022 were reported by the EPA to be about 14,000. However, it's really hard to attribute heat as a primary cause of death. And so with nights and days becoming warmer, heat-related illnesses will be increasing, not just for outdoor workers, but for all of the most vulnerable populations. So we need to improve our surveillance infrastructure and how we're recording these health issues and how we're attributing them to heat. And I'm going to talk a little bit more about that in a little bit. But now let's talk about the farm worker community in North Carolina. So North Carolina, it's the sixth largest farm worker community in the United States. There are approximately 2.3 million farm workers in all of the US, but it's really hard to really get a precise number because it's a community that it's hard to reach to do accurate counts. Um, the crops, North Carolina is the largest producer of tobacco and sweet potatoes in the United States. Sorry, I feel like I need to sneeze. Um, and it's the second largest of Christmas trees. So when we talk about structural vulnerabilities in the farmer community, we see that most of them are Latinos, they are Spanish speaking, and are Mexican born. There's also a change in a slight shift in demographics in the last couple of years where we're seeing more indigenous languages popping up in the fields and also including Creole. I should also mention, and I need to add that to my slide, that North Carolina is the largest employer of H-2A visa workers. And so I don't want to get too much too in depth with the difference, but that's something that we should be aware of. And so they usually get paid on a piece pay rate. So depending on how much boxes or how many buckets they fill, that's how much they get paid. So that's an incentive to work long hours, including in extreme heat. And they are also historically marginalized and targeted community. There was a huge historical inequities all the way from indigenous natives to slavery and now modern times. And so the extreme heat impact in the farm worker community is that farm workers are 35 times more at risk of dying than all other outdoor workers. And this is really alarming. This is also due to contributing factors that are economic, so the way that they're being paid, occupational, the work intensity, it's very hard labor. They're very poor or no protections. The environment, so there's lack of water, shade, in their housing too. Sometimes they're not adequate. And it's also structural, so healthcare access and immigration vulnerability. Some immediate impacts of extreme heat is heat-related illnesses, which includes heat rash, heat cramps, fainting, or being dizzy, heat exhaustion, and then heat stroke. There's also injuries due to fatigue or impaired judgment from the sun beating down on them, mental health distress, and increased pesticide exposure. Once, extreme heat and the chemical reaction, it just has increased exposure to pesticides. And some of the long-term impacts are cardiovascular disease, cancer, reproductive health, and acute kidney disease. And that's something that we're seeing across the world in farm worker communities, the increase of kidney diseases in this community. And so we know how to protect the community. There's evidence-based research that says that water, rest, and shade are all that we need to save lives, which seems like just basic human rights for this outdoor population. And so to talk more about the lack of worker protection. So we see that states with heat protection policies currently are California, Colorado, Oregon, Minnesota, Washington, Maryland, and Nevada. And all of these have their own individual type of worker protections. Minnesota only has them for indoor workers. A few months ago, Virginia became the first state in the South to passing a bill for heat protections that would need to be adopted by 2028. And so for North Carolina, where do we stand as a state? So there has been a lot of talk and a lot of advocacy from several groups. Commissioner Farley, who's from the Department of Labor, he recently launched a heat stress advisory council. But notably absent of this advisory council were health professionals and people from the farm worker community. So there's some movement, but it's not where we want it to be. What North Carolina does have is that they have a heat alert warning system that they launched in 2024. And I will be talking a little bit more about this heat alert system. So in terms of federal policies, we have the Asunción Valdivia Heat Illness and Fatality Prevention Act. So this was drafted in 2019, reintroduced in 2025, and it has stalled. Then we had the heat injury and illness prevention in outdoor and indoor work settings, which this was a big step forward because it also included indoor work settings. So imagine service workers in fast food restaurants, how the kitchens are extremely hot, and then in their breaks they go outside, but it's also extremely hot, so they really don't have a respite. And so OSHA proposed this rule in 2024. There was a big public hearing, and you see a photo of me there. I had the opportunity to testify as a private citizen for this rule. And then we had a change in administration and a change in priorities. And there was a major restructuring in 2025 of the National Institute for Occupational Safety and Health. And so there was a shift in workplace oversight too. So not only was the funding and the policies not being passed, but for those states that do have policies to protect workers, there was nobody to really implement these policies. There was no inspectors to make sure that these policies were actually had any teeth. And so this year in April, I believe, the Heat Workforce Standards Act was introduced, but it has also stalled. And so because we don't have federal policies, some states don't have policies, we're really relying on the organizational level policies. And we're relying on employers, on farmers, on community organizations to promote education on how to protect themselves from outdoor extreme heat. And so in talking with the community and really getting involved with the farm market community, I came with the question about what interventions exist to address the extreme heat in the farm market community and what interventions do they want and need. So we know we need water, shade, and rest. So how can we get there? How can we really promote what's the best way to stay hydrated? And you see in the picture, there are even if we have policies that say you must provide water to your farm workers, we need to know what that looks like. Does it look like warm water sitting in the hot field? Does it look like having cups so they can actually drink the water, or do they need to carry around a cup with them? And so I wanted to look at what exists. What do all these interventions look like for the farms that are actually doing something to protect their workers? And so CUIDAR came out of that question, cultivating unified interventions for the development of safe agricultural responses to heat. And so cuidar is a Spanish word that stands for to take care of. This is my dissertation project is a mixed methods. So we're doing survey and we're doing in-depth interviews. We have two cabs. That was the original intent, to have a community advisory board of farm workers and another one of growers, which would be the co-design team. So with them, we would co-design what this intervention looked like. And so with that, we intended to move beyond surveillance and education towards a community designed implementable heat protection toolkit. And so this is the team, my community partners that have been with me for the last 3 years, the North Carolina Farm Worker Health Program, Piedmont Health, a lot of community supporters that when I attend Farm Worker Institute meetings, or just getting really involved with the community, they have really supported this program, this study. So we have Access East, Amexcan, El Futuro es Nuestro, NC Field, Student Action with Farm Workers. And I'm also working with Andrea Mendoza, Lina Shahid, and my dissertation committee, Doctors Hayden Bosworth, Amy Cornelli, Leonor Corsino, and Kelly Taylor. And I don't know if there's, I see some chats, but I don't know if I should, please interrupt me if I need
No,
to address
I
anything.
just put the story of Asunción Valdivia because it took somebody dying after picking grapes for 10 hours straight in 105-degree temperatures for legislators to take action. But there have been multiple Asunción Valdivias, unfortunately.
Yes. Thank you for doing that, Viviana. And yes, like you said, unfortunately, it's for the last 3 summers that I've been working with this, there's been a death, and it's not of what can we prevent? Can we prevent any deaths? It's how long until the first death happens, which is really unfortunate.
Uh, when you were sorry if I may interrupt, when you were presenting about this, I was thinking of the soccer cup, the World Cup right now, and players get a 15-minute break
Hydration
after
break.
20 minutes, right? For water, and but of course that 15-minute break earns $500 million to Fox in advertisement. The breaks of farm workers don't earn anyone money, but they earn health, and you can't measure the cost of death through illness.
Yes.
It's like
And,
the balance is.
yes, absolutely. And, when I did notice those hydration breaks, and there has been research about comparing farm worker, the amount of physical labor that goes into farm workers' jobs comparable to those of athletes, like doing that same of strenuous work in the heat. And yes, why can't we have mandatory hydration breaks? And it's in talking about how can we sell these interventions to convince the organizations, the farms, the growers that it's really worth it. They will be more not just healthy, but they will be more productive too. And so that is something that we're also trying to figure out with the toolkit. And so with the CUIDAR, this is a conceptual model of my research. And so we have 3 main goals, and we wanted to start with identifying the existing interventions. So doing a systematic review, what has been published on the interventions that exist, cooling fabrics, having those backpacks that military people use, and now that, started in the military. And ironically, a lot of the military um, stuff we have translated to civilian jobs. The backpacks with hydration packs. So just looking at that and the efficiency of those. And then the second goal was to assess the knowledge, the attitudes, and the practices of the farm worker community in North Carolina. So with the community, we developed a survey. We wanted to know what questions we should ask, how we should ask them. And so we designed it with farm workers. And now we are in the survey administration phase. So right now we are starting to gather, and actually tomorrow, Thursday, it's our first day to go out to collect surveys from farm workers. And so then in parallel, we're also working on our goal three, which is our design team. So we've created the community advisory board of farm workers. We have 8. And with the growers, it's funny because, it's been the intention since day one was to have the same, we knew it might be harder to get growers. So we said, let's do a cab of 6 growers, 4 to 6 growers. But it's been really stressful for both farm workers and growers. And it's just been a really hard heat season in terms of policies, in terms of financing. The morale is really low in the fields. And so it's a difficult time to go out there and try to do research, but we're pushing and we're moving along. Um, there's a lot of interest, but the morale is low, if that makes sense. Wages were lower this year. A lot of the farm workers came, they arrived, they didn't know they were going to get paid less than last year. And so some of them, they're charging them for their housing, which in the past, the housing was a part of the contract. So a lot of things have changed this last year. And so it's been really hard. And I think it's even more important to listen to their stories to see how this is impacting and how it's going to have a trickle effect into our food prices in the end, right? If we really think of the whole agricultural system. And so we're also going to have in-depth interviews where we hope to get all of those answers. We're going to interview growers to see what are the barriers for them to actually provide these preventative items, water, shade, and rest. What's preventing them from actually doing it? And so our goal is to have a toolkit of an intervention that's ready to pilot and to share with the community what we find. And so what we anticipate this toolkit would look like, it would include targeted education, so curriculum developed for farm worker health and safety, structural improvements of standardized protocols for water accessibility, shade, and mandatory rest intervals. And so by looking at what interventions exist and what the community wants, we can come up with hydration breaks, for example, and sort of pilot what that looks like. And if we can attach a monetary value to that, to the improved efficiency and the health, I think that would be really great. And to have a cultural alignment. So have community vetted terminology for communicating climate and extreme heat risks. So this can be challenging in a community that has a lot of competing priorities, right? They need to make a salary. They need to provide for their families. That's their number one priority. Climate change is a thing of the future that they don't have time to worry about right now. Extreme heat and their health, that can wait. They need to make money now. And so how can we talk about this and also address the urgency of that while also acknowledging their other conflicting priorities? And so I mentioned the heat alerts. So recently, I co-authored this paper on navigating the heat, where we talk about North Carolina and the 2 things that they have going for extreme heat. So they have a surveillance system to keep track of how many cases report to the emergency department that are tagged. They have an ICED code for extreme heat. And so we offer recommendations to how to improve that system by including community clinics, by including communities that typically farm workers would go to. So that's a huge segment of the population that we're currently missing in this data set. Another thing is the North Carolina Heat Health Alert System, which is currently only email based and it's county specific to opt in. So for the farm worker community, smartphone ownership is really high. However, culturally, they don't have a practice to check their emails like we do in the mornings to see how our day is going to look like. So we made a recommendation to include text notifications for heat alerts, not just email based, and to also not just make it focused on county specific, because for farm workers in mobile communities that move around, say Durham County to Sampson County, um, if they unless they go back into the system and sign up, submit another form, sign up for Sampson County, they're not going to get the notifications for that. So what we recommend is something like the wireless emergency alerts that we all get immediately on our phones when there's a flash flood warning, right? So utilizing what already exists to improve these systems. And so that's also part of what we're looking at. What interventions exist and how can we make them better to serve this community? So our next steps, as I mentioned, we're recruiting for grower for our community advisory board or a focus group. We're still trying, hopefully we are able to have um, enough growers to have a cab. If not, we would probably move to a focus group. We're also developing our interview guides for our in-depth interview guides that will probably happen around August. And then we are currently deploying our survey. As I mentioned, tomorrow we're going to a community clinic to recruit farm workers. And then we're going to finish our intervention co-design, and then our next step by next year, we hope to be able to pilot the intervention. And so if any one of you is interested, has some access to farm market communities that you think, our goal is to be able to include as many counties across the state as possible to have a diverse representation. So if you want us to come out to the community, please reach out to me and let us know. And so the impact that we hope to have with CUIDAR is to have enough data to pilot this study. The results can inform preventative measures against heat-related illnesses at an organizational level. So again, this is important since we don't have state or federal policy. So organizational level, what can we do? And encourage the adoption of interventions by both farm workers and the growers while we wait for that policy, and to provide more information to growers and farm workers on existing interventions. And I think this slide deck was timed, so it just keeps moving forward. And so some key takeaways are that extreme heat is a preventable occupational health threat. We know what works: water, shade, and rest. Farm workers must be co-designers and at the center of these interventions and not just recipients. And with CUIDAR in this study, we hope to create a scalable model for climate resilient agricultural workforce. And so this is a picture of my cab. Thank you. Gracias. Let me know if you have any questions. The QR code that takes you to the CUIDAR website too.